So I had a doc reach out to me this morning and ask me a question that I had to go live and respond to because it's kind of funny. He asked, with cone beam CT, what am I using to hold the temporal supports out and open while I'm bringing the patient in? And so I'm going to show you that. I'm going to reverse the camera here. So, oh wait, hold on. There we go. So we use the one and only Bulow upper cervical imaging chair when we do all of our images, and that's so that the patient can sit up vertical and close their eyes. A lot of times they'll be sitting in the chair. We'll have them close their eyes, right, left, up, down, just come back to center, whatever feels normal and natural and neutral for them. And then, because we have the imaging chair, we can wheel them into the cone beam scanner without them feeling like they consciously or subconsciously have to jut out their chin to get into position, which would obviously create an artificial anterior head carriage. Or maybe they're scared, maybe they back away. So I actually prefer the eyes closed for a couple reasons, for just accuracy, but patient comfort, you know. Now, that being said, what the doc is asking is when we do that, we have to open up the temporal supports while they come into the scanner. And the question is, how do we, normally the way this works is you have these levers that you have to push to open them up, but they're spring loaded. So how do we keep it open? I'm about to show you, and I think it's kind of funny. So here are the temporal supports. We look down, look over, wha-bam. And any of you that have children know exactly what this is. This is a child lock for a cabinet, you know, in your kitchen to make sure kids don't get in it when they're toddlers. And so literally this is like a seat belt. It's adhesive at the bottom, wraps around, locks in. So patients there, close the eyes, right, left, I push them in, I circle around, come in the front, take out rotation, make sure that the laser dot is in the top of their head, they're centered, and then I come over here and I unlock this, bringing in the temporal supports closer so it squeezes the head. So great question. Shout out to Dr. Chad Combs, by the way, and out there in, I believe, Cincinnati, Ohio, but I'm not 100% certain. Some good upper cervical docs all over the country. I hope you guys have a great week. Thanks for hanging out with me. Hope you had a good laugh, and or hope that helped. The Bulow chair is great, upper cervical imaging chair, and baby protective straps are resourceful. Remember, kids, the greatest resource is resourcefulness. All right, see ya.